Hello, everyone. Welcome to my new More Than Lupus headquarters here. As you can tell, it's a different background I have. I moved almost 2 weeks ago, so I'm excited to be joining you from my first virtual educational event from my new office. Today is going to be an exceptional event. I'm so happy to have you here. And please, please, please share this on your personal Facebook page because anyone who shares this chat, and you're going to hear me say this again, anyone who shares this chat and writes shared in the comments will be entered to win a brand new copy of the hot off the press second edition of the Lupus Encyclopedia. I see a lot of people already logging in, which is very exciting. So thank you for joining us for our special presentation entitled Lupus Secrets, an educational symposium presented by More Than Lupus. My name is Kelly, and I am the creator and executive director of the Portland-based nonprofit More Than Lupus. And if you're unfamiliar with More Than Lupus, we are a multi-ethnic, multi-generational, international lupus community designed by lupus patients to connect, grow, and inspire each other throughout the peaks and the valleys of our lupus journeys. And I say are because I have lived with systemic lupus erythematosus and multiple lupus overlap conditions since the age of 11. Now, we believe that every person living with lupus, no matter their background, should be treated with equity and dignity and taken seriously. And it's our mission that patients feel heard, seen, and valued. So today's event will spotlight some very important information, perhaps even some do's and don'ts that may help you live the fullest life that you can live with lupus. But before we go any further, big announcement. Make sure, I told you I was going to say this a few times, you share this live event on your personal Facebook page so that people can not only get connected to community and also have access to this incredible information shared today, but anyone who shares this chat and writes shared in the comments will be entered to win at the end of this presentation. Are you ready for this? A brand new copy of the highly anticipated, hot off the press, new second edition of the Lupus Encyclopedia, written by no other than our special guest today, inventor, I should say, of the Lupus Secrets list of do's and don'ts, which will be highlighted today, Dr. Don Thomas. Hello there.
Hey, Kelly, and thanks everybody for coming in and listening.
Oh, so good to have you. Okay, Dr. T, before we get started, let me do our responsible bit and give everyone a brief disclaimer. So please understand that the opinions shared today are purely for informational purposes and do not replace the medical advice and or opinions of your doctors. If you're experiencing lupus or lupus overlap symptoms, skin issues, photosensitivity, whatnot, it is important to follow up with your doctor and to seek the treatment that is best for you. Dr. Thomas is a qualified professional. However, he is not liable for his comments since he's not acting as your personal physician or health advocate. Well, welcome, Dr. T. I'm so happy to have you back with us again.
Thanks, Kelly.
Now, I think since time is of the essence, we should just dive right in. You're going to talk about your famous list that I follow to the best of my ability, the Lupus Secrets list, which is available in the book and online for us as well.
Yes. So Kelly, back in 1993, I became a rheumatology fellow, and I knew right away I wanted to specialize in helping people with lupus. And in Du Bois' Lupus Erythematosus, which is the Bible for rheumatologists to learn about treating lupus patients, Dr. Dan Wallace and Dr. Bevra Hahn, who are in California, they had at the end of the book a list of do's and don'ts that lupus patients should do above and beyond just taking medications. And I figured out very quickly that caring for their lupus was much more than just taking medicines. Things like avoiding ultraviolet light and avoiding triggers that can cause lupus to flare up, and avoiding other complications that lupus can cause. And so over the years, I put those together and I called them the Lupus Secrets, not because I wanted them to be a secret, but because they were most patients and most rheumatologists did not know about them. And over the years, I've added onto that list as the medical research has shown additional things over time. And then in 2010, Johns Hopkins Press got a hold of me. They heard a lot of the talks I had given, and they wanted me to write a book based upon the Lupus Secrets, and that's how it came about, the Lupus Encyclopedia. And this is my second edition. I just got it last week, so it's hot off the press. People who order it will get it September the 5th. But we're giving away a free copy. I will ship it to you myself personally and autograph it. You just have to share this Facebook spot right now, and then type shared in the comments section, and then Kelly at the end will draw your name, and then just send me your shipping address to my email, which I put in the comments section, lupusencyclopedia@gmail.com.
Well, oh my goodness, people are sharing this chat like there's no tomorrow. I think there's some anticipation about this new book, Dr. T.
Hopefully. I'm glad so. Well, would you like to hear about some of my favorite lupus secrets, Kelly?
I would love for you to give us the lowdown of the Lupus Secrets.
Okay, I'm just going to, there's about 50 of them. What I recommend that people do, by the way, is don't just look at them and say, oh, these are really important, I should do them, then just toss them to the side. That's what most people do, and that's why many do not do well with lupus. What you really want to do is print out the Lupus Secrets, go to my website, lupusencyclopedia.com, click on Lupus Secrets at the top. You don't have to buy the book. Just print it out, and then sit down at your coffee table, take a yellow highlighter, highlight everything on the list you're not doing or that you didn't realize you should do, and then try to incorporate all of those into your life. If you do, I promise that you'll do better with lupus and live longer with your lupus than if you did not do them. So here's some of my favorites. Number one, did you know that most doctors' medication lists are wrong? 100% wrong. I just had my colonoscopy yesterday, and their list was wrong. They had me taking alprazolam for anxiety, which I'd never taken in my life. With electronic health records, mistakes absolutely happen. And a problem that my medical assistants run into is that they'll ask patients to go medicine by medicine on their list, and some of them get upset and say, you know what I'm taking, and that's wrong. Don't do that. What you want to do is always have an up-to-date medication list with the drug name, the milligrams, how often you take it, carry it around on a piece of paper everywhere you go, and especially to all doctor's visits. And when that medical assistant says, okay, let's go over your medication list, most of them will incorrectly say, are there any changes in your medicine list? Don't accept that and just say no changes. Give them the list and have them double check it. So that's number one. Number two, include your allergies and drug intolerances. And on that drug intolerance, always put down sulfa antibiotics. Sulfa antibiotics flare up lupus in a lot of patients, and this is what happens. A patient will end up in the emergency room or urgent care center with a urinary tract infection, one of the most common infections in women, and especially lupus patients. And oftentimes you're quite sick and you don't remember to tell the doctor everything. The drug of choice is a sulfa antibiotic. You take it, then you end up in my office a week later with a horrible lupus flare. And I've seen that at least once every year or two, even in my own patients. So protect yourself. Have sulfa antibiotics down as one of your drug intolerances, even if you've taken it before and you did fine, because it could still potentially flare your lupus. Protect yourself. Number three, always keep records of every lab, biopsy, x-ray, doctor's report, specialist report that you ever get. after all visits, just contact the office or go by the office and ask them for a paper copy, and keep a personal record of yourself at home. I just got done doing this, by the way. I had a colonoscopy yesterday. I had my hand out and I took pictures with my cell phone. There's a great app called Scanner Pro. Takes great pictures, and they're very easy to email to myself, and then I emailed them to myself, and I included them, downloaded them into a file on my personal health records, so I always had that copy to give all my other doctors. But this is one really important reason. Did you know 20% of the time to 30% of the time, when your lupus is well treated, your anti-nuclear antibody becomes negative? You change insurances, or you travel somewhere else because of a job, or you just want to move, you see a new doctor, rheumatologist, they do all your labs, you look wonderful because your doctor did such a good job, and your ANA is negative, and they say, rheumatologists don't trust each other, by the way, because a lot of patients are incorrectly diagnosed with lupus, but they'll say, I really question that you have lupus, and they'll stop your medicines and they'll say, let's see what happens. I had one patient who got a stroke because that exact scenario occurred. I had another patient moved to Chicago. Her lupus attacked her lungs and she developed inflammatory lung disease and got really, really sick. So protect yourself. If you have those first biopsies and labs and doctor's notes that prove your diagnosis of lupus, that could save your life. So please always do that. Ask all specialists to send all notes and test results to your rheumatologist. Lupus can affect every organ system of the body, and not all doctors realize that lupus could be the culprit and don't always send us notes. In fact, unfortunately, with today's busy regimens and electronic health records, it just it's frustrating to me that I don't get these notes as I should. I had 2 patients where lupus attacked their heart. The cardiologist never sent me a note. They had something called cardiomyopathy and myocarditis, and they ended up back in my office, and they were already in congestive heart failure and on heart medicines. It was too late for me to do anything. But if I would have known, I could have treated their lupus better and kept that from happening. So protect yourself, and just verbally, don't tell the staff, just verbally tell the doctor at every visit, beforehand and afterhand, say, please send Dr. Thomas or my rheumatologist a copy of your note from today and all test results. But also, even do a step above, get copies like I did of my colonoscopy yesterday, and give that to your rheumatologist and your primary care provider. Secret number 5, see your rheumatologist at least every 3 months. Lupus nephritis, where it attacks the kidneys, occurs in 40% of our patients. Did you know that lupus patients feel perfectly fine, 0 symptoms when their lupus nephritis first starts? Yet, if it's not identified quickly and treated quickly, it can be a cause of end-stage kidney disease, dialysis, and even death. But if we catch it early, it's curable almost all of the time in my experience. And we do that by checking a urine protein, something called the urine protein creatinine ratio. So that's why we want to see you every 3 months, even if you're feeling wonderful. Do that for the rest of your life. You know, the most common cause of death in our lupus patients, and thinking about what causes death, it sounds morbid, but it's important, because if you know what can cause it and how to prevent it, that knowledge is strong. The most common cause of death is heart attacks and strokes. They occur 20 years earlier than they should in our African American female patients, 10 years earlier than they should in overall in all of our lupus patients. So you want to keep your blood pressure perfect, your cholesterol perfect, exercise regularly, eat a heart healthy diet, but go above and beyond that. Have a home blood pressure monitor. Another lupus secret: check your blood pressure 3 times before all doctor visits. Hand carry that into us and show it to us. The cardiologists tell us that home blood pressure readings are more accurate than what we get in the office. Just think about all the times you rush in and your blood pressure is high and you say, oh, that can't be right. It's because I was rushing in. Show us what you had at home. That's what's more accurate. And then plus, oftentimes it's higher than what we get in the doctor's office. Did you know that HDL is also known as good cholesterol? protects the heart from heart attacks and strokes. But guess what? Lupus is a weird disease. The inflammation that it causes and even antibodies that can attack cholesterol actually convert HDL, good cholesterol, into bad pro-inflammatory HDL in many of our patients. And high levels of that particular type of HDL actually increases inflammation of the blood vessels, heart attacks, and strokes. So when you see your primary care doctor, if you have a high HDL, they're probably going to tell you that you're under great shape because you're protected. Unfortunately, that's not true. And most doctors don't know this literature, by the way, so they're not going to know. If your total cholesterol is high or your LDL bad cholesterol is high, you need to be on a statin to lower your cholesterol. But what's been shown to be helpful for high pro-inflammatory HDL is regular exercise. A study by Dr. Bev Rahan and Dr. Dan Wallace showed us that those lupus patients who exercise regularly had much less pro-inflammatory HDL and less hardening of the arteries. Infections are the #2 cause of death in lupus patients. I've learned that the hard way during COVID-19. I've had too many patients die. And guess what? All of them, or most of them, were unvaccinated patients. I have had all my COVID vaccines as my choice because I know it helps me and it will help me stay alive. So when we look at the infections that kill lupus patients, almost all of them are preventable with vaccines. So get your flu shot every year. All patients, no matter what your age, should get a Prevnar 20 just once in your lifetime. That's all you need for pneumonia protection. And then, my next door neighbor a few years ago, he died from throat cancer. The cause of his throat cancer was human papillomavirus, HPV virus. A wonderful friend of mine, she developed anal cancer because of HPV virus. My generation did not have protection, but today, younger people, you have that protection from a vaccine called Gardasil. We don't know why, but it's probably because of the abnormal immune system. When we diagnose someone with lupus, they're much more likely to be infected with cancer-causing HPV. If you're between the ages of 9 years old and 45 years old and you're not monogamous, please get the Gardasil to prevent cancer, because our patients do get HPV-associated cancer a lot more often. So please do that. And I totally understand that no vaccine is 100% safe. You're going to see on the internet bad reactions, Guillain-Barré syndrome, and so forth. But those are incredibly rare. They're nothing like the amount of infections and cancers that we see. I mean, I have never seen a patient get a severe reaction to any vaccine in my 30-year career, but I've certainly seen deaths and cancers. My next lupus secret, that prescription for hydroxychloroquine, please take it religiously. Kelly, did you know that 45% of your viewers right now are not taking their hydroxychloroquine regularly? And I know that because every study shows it. And just a few years ago, when I started checking levels in all my patients who were not in remission, most of them were not taking their hydroxychloroquine, and I was shocked. So I checked it. I check it every time on my patients. Today, they know I'm watching them like a hound, and they almost all of them take it religiously. And guess what? When they do that, the remission rates in my clinic increase dramatically. We know that hydroxychloroquine increases remission rates 3-fold in our lupus patients. Another lupus secret: most rheumatologists don't know about ordering hydroxychloroquine whole blood levels. Be proactive in your health care. Next time you see your rheumatologist, say, please, could you please order hydroxychloroquine whole blood drug levels from LabCorp or Quest? They both order them now. Your insurance will cover it. It can help you in a couple of ways. Our goal, by the way, is between 1,000 and 1,200. Write that down, 1,000 and 1,200. That's what you want your rheumatologist to aim for. Make sure that you skip your hydroxychloroquine on the day you do your lab test. Just take it after the lab. It's more accurate that way. And then we want to have it above 1,000 because that decreases flares And it also decreases the risk of heart attacks and strokes. Both of those things proven by Dr. Michelle Petrie at Johns Hopkins. And the most dreaded side effect of hydroxychloroquine, which is rare these days, is retinopathy, where it deposits in the back of the eye and causes vision problems. But if you keep the drug level below 1200, that is markedly lower. So it helps us in those two ways. It helps efficacy and helps decrease side effects. You know that in order to decrease your risk of retinopathy, be proactive in making sure you get the right eye exams every year on hydroxychloroquine. Many eye doctors do not have the right equipment. When I get an eye exam result from those doctors and it says no hydroxychloroquine toxicity, I never trust it. I always ask them exactly what machines they were using and the results, and a lot of times they didn't use the right machines. You want to ask your doctor for two things: a visual field 10-2, write that down, 10-2, not 24-2 or 30-2, which all ophthalmologists have, but 10-2, and something called an SD, D as in Don, OCT. So SD, OCT. You want both of those done every single year. If you get those every year, they just did an article a few months ago by Dr. Marmor and Mells, who are the world's experts in hydroxychloroquine, and they said with these two tests, it's incredibly rare to have any vision problems ever from hydroxychloroquine. If you're watching this and you're Asian, another lupus secret, you need 3 eye exams, and most eye doctors are not doing this either. If you're Asian, in most people, if they get hydroxychloroquine toxicity in the eye, the retina looks like this, and the damage occurs right in the middle, in the 10-degree area. So that's why we say 10-2. 10 means 10 degrees. But in 50% of Asians, it occurs on the periphery or outside of that area. And so they also want to have the visual field 24-2 or 30-2. So an additional visual field test. And then just a couple more, and then I'll be done and be happy to answer any questions that you might have. So there's a lot of things that trigger lupus, so many things, and avoiding those things are so important to keeping your lupus from flaring up. For example, get at least 7 hours of sleep every night. Multiple studies have shown now that family members, for example, all of you who are watching this who have lupus, your family members, those of them who get less than 7 hours of sleep at night have a 3-time increased risk of developing lupus. And more than 10% of them will develop lupus in the next 6 years. And that's been shown by a couple of studies. But it's the same with flares. Make sure you get at least 8 hours of sleep every night. Ultraviolet light it contacts the skin, damages the cells underneath the skin. They release their nuclear contents. Your anti-nuclear antibody and anti-double-stranded DNA thinks it's a foreign invader, combines with it, goes through the body, especially the kidneys, to cause inflammation. So you want to wear sunscreen religiously all the time, even if you don't go outside, because fluorescent lights and incandescent lights give off ultraviolet light all the time. You're just constantly bombarded with this low amount of ultraviolet light, but it's enough to damage those skin cells. Most of us, we just wrinkle up, but the lupus patient, it's much worse. Even better, in your own home, you do have some control. You want to get LED light bulbs. LED give off no UV light. And then my last lupus secret, eat an anti-inflammatory diet. There's more and more evidence that having anti-inflammatory foods, like foods that are high in omega-3 fatty acids. I keep a big bag of walnuts, fresh raw walnuts in my refrigerator, cheaper by bulk from Amazon. I grab 6 of them every day, eat them. That's enough omega-3 fatty acids, very easy to do. You want to also increase probiotics and prebiotics. Prebiotics are foods that feed the bacteria, and probiotics. Don't take supplements, by the way. Some bacteria probiotics actually can make lupus worse. But what you want to do is get the natural probiotics, because they have the types of bacteria that have been shown to be beneficial in lupus. So things like a culture positive yogurt, kimchi, kombucha. There's a other long list that you can look up on the internet, and then feed those bacteria with prebiotics. There was a study looking at resistant starches that showed that lupus mice got much better and had much less severe lupus when they ate a diet rich in resistant starches. And that's things like cold oatmeal, cold overnight oatmeal with some yogurt. Perfect prebiotic and probiotic. And then, Kelly, I'll be happy to answer any questions.
Wow, that was a fantastic plethora of information. Oh my goodness. Well, the comments are coming in hot, and so are all the shares. I've been keeping up with this amazing amount of engagement here, Dr. T, but we do have some questions. So we can get to the questions, or would you like to give us maybe a couple little pearls of things that are in this edition of the book? What would you like to do first?
Yes. So some people have asked on social media if it's worth getting the second edition if they already have the first. The first is very comprehensive. Most of it is applicable today. So people who can't afford the book, get a used copy of the old book, $5, $10 on the internet. But this is even much better. I have 50 world lupus experts, and each of them help me with each chapter of the book. So everything in here is even more up to date and even more accurate than the first edition. And it's already on sale at Amazon.com. But I hope that you guys win this book. That'd be even better, and I'll ship it to you myself. But other new things in the book is, and I'm asking this with my new book too, is if you have any recommendations on things you'd like to see in the book, send me an email at lupusencyclopedia@gmail.com. I read them, and I actually looked at all of those, and I included those in the new book. Number one, I included rare lupus complications. The old book didn't have the rarest ones, and the problem with those rare complications is that it's so hard to find reliable information on the internet. So I included those in the new book. There's been 2 new ways of diagnosing lupus called classification criteria since the new book. Those are included in the book. I talk about leaky gut syndrome, or what we more accurately like to call the microbiome, which is beneficial bacteria and harmful bacteria in the gut that interact with the immune system that can make lupus worse, and how to make it better. But also we have the same thing going on in the mouth and on the skin. So we talk about that. Today, most of our lupus patients can have a normal, successful pregnancy, and I give you a very easy guide on how to have that successful pregnancy in chapters 18 and 41. I talk about healthcare disparities, which is something incredibly important and that came to the forefront during COVID-19. Did you know, Kelly, that 1 out of every 5 adults with lupus started out as children? And so, I didn't have a pediatric chapter, and so now we have a pediatric chapter, and Dr. Suley at the head of the rheumatology department at the National Children's Hospital helped me with that chapter. So I'm really happy with that. It's actually written for children with lupus and their caregivers as well. We talk about the new drugs for lupus, all the vaccines, how COVID-19 affects lupus, all the new information on hydroxychloroquine. The old hydroxychloroquine dosing in the old book is incorrect, and it's best. The dosing is much better by drug levels, by the way. I hate doing it by body weight, which the American Academy of Ophthalmology came up with, but they didn't look at effectiveness and they didn't look at drug levels. They only looked at the eyes and nothing else. And the problem is that hydroxychloroquine absorption rates vary from 25% to 75%. How in the heck can you dose something by body weight? So drug levels are better, and I talk about all that in the hydroxychloroquine part. The new FDA-approved drugs for lupus, Lupkynis, which is voclosporin, and anifrolumab, which is Lupkynis. We talk about those in detail. We have great new sections about non-drug therapies, diet, sleep, reducing stress, and complementary medicine. I have some experts on integrated medicine from Stanford and Johns Hopkins, who talk about mindfulness, yoga, and other really important body mind complementary medicine things that really have shown benefit in lupus. And then also even a chapter on CBD or medical marijuana. Does it help or doesn't it? And how safe is it? And we talk about all that.
Oh my goodness. Well, if that isn't enough to put this in your cart on Amazon, I don't know what is. Holy cow, that is a lot of pearls there. I cannot wait to read your updates on all of those lupus hot topics.
Thank you. I'm really excited and happy about it, Kelly.
Yes,
I really am.
Yeah, I am so excited. I wore my last copy out, so I need a new copy, and I can't wait to read all the updates.
Oh, by the way, Kelly, a big recommendation is if any of you get it, please read the preface. I mean, this is a huge book, 900 pages, and there's just no way to read it all. Read the preface, and it gives you a step-by-step way to best use the book and get the most out of it. So please do that. None of us ever read a preface, but read this one.
Actually, that was one of my favorite parts of the first edition was the lupus history. I love the tidbits you gave about the Peruvian mummy that was discovered in 1860 of having, I think it was 1860 AD, of having lupus, or what they assumed was lupus, and the basilica, the story about the basilica and you visiting that. I mean, all those historical references I love. There's just a nice, it's just a really great, full amount of knowledge from the history of lupus to all the things that are happening presently and what we hope for the future. And I really love that.
And can I say something really quick? I'm glad you brought up about the basilica. In Liège, Belgium, there is a church, actually a basilica built because the bishop in the 10th century was healed of lupus. A church that was actually built because the Bishop of Liège it was 959 AD, he developed lupus and he described it as having open painful sores all over his body, but is also attacking his insides, and the disease was popularly called lupus. He wrote this in an affidavit to the Catholic Church way back then. There's no question about where lupus gets its name from, because it said it was called that because it looked like the bites of a wolf. If you go to YouTube and just type in Donald Thomas, Bishop of Liège, you'll be able to see my videos on visiting the church, and I show the actual sarcophagus of the bishop who had lupus from the 10th century. It is a fascinating story. This edition, by the way, doesn't have the history. There was just too much great medical information to give, so I had to sacrifice some of my the things I love, and I had to sacrifice the history.
Oh, well, most of us have a copy of the first edition, so we'll always have that to go back and read. I love it. And didn't you, not to get in the weeds here, but didn't you visit that basilica?
Yep, I visited it. I took pictures. We have a video of me going through the church and showing the sarcophagus. And by the way, there's an error in my first book. The interesting thing about medieval history is that a lot of texts were written and they put in the wrong dates and even the wrong authors. And I put in the wrong date in my book. I just talked to another historian who put the wrong date in his journal article in a major journal, medical journal about the bishop. And so we're going to write a new journal article and have the correct dates and everything. It was actually 959 AD.
Wow. Well, there you go. You hear it now. Here, everyone, make sure you put that in your notes in the first copy of the book. Okay, Dr. T, we do have a few questions that came in that were pre-submitted to us. And then we have several that are coming in now.
Oh, great.
Just a disclaimer for everyone watching, Dr. Thomas cannot answer all questions since he is not acting as your personal physician. If you heard the disclaimer in the beginning, I just wanted to remind you of that. But he'll do his best to give a subjective opinion. So the first question, my 11-year-old daughter, who has had lupus and lupus nephritis for 4 years, recently was told by her doctors that we need to start Rituxan. Can you talk about this medication and how it is different from Benlysta, which she tried and unfortunately failed?
Sure. I'm so sorry to hear that. It has to be very very hard as a parent to see your child going through this. Rituxan, we absolutely use it in lupus nephritis when people fail medicines like Benlysta, lupkynis, cyclophosphamide, and mycophenolate, and it absolutely does help many of our patients. But it's both Benlysta and Rituxan, they both work on the B cells. Benlysta, it decreases, it makes B cells that make antibodies retire and go to sleep and be recycled sooner than they should, instead of being alive all the time. So that anti-double stranded DNA making B cell can die instead of attacking the body. But Rituxan works very differently. It binds to the B cell itself and actually kills it, and so it depletes the body of B cells, and so it oftentimes will work when Benlysta doesn't. And please make sure your daughter is taking her hydroxychloroquine. Unfortunately, our children are the worst at taking their medicines, and that's no surprise to any of us. But if your daughter takes her hydroxychloroquine religiously, that will increase her risk of remission by 3 times. And so I hope she has taken it regularly. Also, vitamin D. If her vitamin D level is less than 40, another lupus secret, always have your vitamin D checked. And if it's lower than 40, get on vitamin D and take it religiously. White blood cells need vitamin D to work properly, and it's actually a really important treatment for lupus.
That is really important to know, absolutely. And the next question that came in said, I just started a new medication for my skin lupus called lenalidomide.
Thalidomide.
Yes. I had never heard of it, and I don't know anyone else who has been on it. Can you tell me more about it and things to possibly be aware of?
Sure. So thalidomide, that's the drug that caused the FDA to become much more strict on how we have clinical trials and get drugs approved today. Back then, in the late 50s and 60s, they trusted the drug companies way too much. And they said it was a safe drug. Lots of pregnant women took it all over the world. And unfortunately, we saw tons of malformations in children where they had loss of limbs and short limbs. And it was just horrible. But today, remission rates are about 95% in our patients with severe lupus that attacks the skin, like really severe discoid lupus that's very scarring to the face and scalp. 95% remission rate. So it's just phenomenal. But you have to make 100% sure you don't get pregnant. You have to use 2 forms of birth control just to make sure. Peripheral neuropathy can happen, damage to the nerve. So if you get any tingling of the feet or hands at all, let your doctor know right away. But if I had severe discoid lupus or cutaneous lupus and everything else failed, I would absolutely try it. Just be cognizant of what the potential side effects are. Don't get pregnant, and let your doctor know right away if you get tingling or numbness.
Wow, 95% remission rate. That is
Easy.
incredible. Incredible. Wow, that's really great to hear. Okay, so the next one that I have here, you kind of already answered this question, but I'll read it so that they know I did. So I read once that you test your patients' hydroxychloroquine levels. Is this something I should be asking my doctor to do, and why?
Yep, be proactive. Again, like I said, if you keep it above 1,000 and less than 1,200, you decrease your risk for flares, heart attacks, and strokes, and you decrease your risk for any eye problems. You want to get your lab test done with the whole blood hydroxychloroquine drug level, then take your dose later on in the day, and ask your doctor to do it every time you do labs. Just say, please, could you possibly do this? And just be very tactful about it. You can get it from LabCorp and Quest.
Another question that was asked actually at our support group that we had earlier today was about IVIG and IVIG for the treatment of neuropathy related to lupus. She wanted to know how common is that to use IVIG for that, and any possible information or insights as to the success rate.
Sure. So this is a a pretty new thing to use, and I have been incredibly impressed with IVIG in my
Mm.
patients with nerve problems and lupus and Sjogren's disease. To learn about IVIG, by the way, it's very hard to find information on the internet, but go to lupusencyclopedia.com, my website, and just type in IVIG for the search engine, and I put in a blog post putting it in easy to understand language about what it is and how it works. But I sent several patients up to Johns Hopkins to see a doctor named Dr. J. Pasricha, who's an expert in a nervous system problem called dysautonomia or
Mhm.
autonomic nerve dysfunction. It includes things like POTS syndrome, which some of you may have heard about. He recommended IVIG in all three of them. These were really sick patients who had failed everything, and I have just been astounded at how much better they did. Their autonomic nervous system problems like dizziness, mental fog, fatigue, feeling lightheaded or dizzy, also stomach problems, all those things got better, which I was not optimistic at all, by the way, not at all optimistic. And now Dr. Pasricha has gone to the Mayo Clinic. He's working with Dr. Brent Goodman, who's a Sjogren's disease expert and the nerves, and they're opening a dysautonomia center, and IVIG is being used more often. We know that dysautonomia, for example, is underdiagnosed. 50% of our Sjogren's patients have it, for example. We don't know the incidence yet in lupus, but I wouldn't be surprised if it's as much. So good luck if you go on it. I hope it helps.
Whoa, wow. That is incredible. And IVIG is a derivative of a blood product. Is it difficult to get for patients?
It can be hard to get insurance to cover it, but I'll tell you the secret. Make sure your doctor, if they prescribe it, make sure they send you to a hematologist oncologist. Those are
Mm.
experts in blood and cancer because they're much better at getting this approved. Also, make sure that they include certain things like if you have a low white blood cell count, that can help get it. Make sure to absolutely mention the nerve problem with your diagnosis of lupus or Sjogren's disease. And if you have any muscle inflammation, that can help you get it as well. If you have lung inflammation, that's another thing that can help you get it pre-approved from your insurance company.
Oh, that is really helpful because I know a lot of us, that is half the battle, is getting through the insurance wall. Wow.
And it
Okay,
frustrates
so,
me every day.
oh, I'm sure it does. You're trying to help your patients. Absolutely. Okay, so Sharon asked here, do lupus patients have high rates of allergies and anaphylaxis in relation to the general public?
Yeah, that's a great question, Sharon. Large studies suggest that they do not, but there are some studies that show that lupus patients probably have more medication allergies than other people, especially antibiotic allergies. None of these things have been proven beyond a doubt, but I do believe that lupus patients do have more drug allergies because I just have long lists a lot of times in my lupus
Mhm.
patients. So I wouldn't be surprised if that's true. But the allergies like seasonal allergies, pollen, things like that, it involves a different part of the immune system. So it wouldn't surprise me if those are not increased. But we're always being surprised in medicine. I will say that it's not proven beyond a doubt that lupus patients don't have more allergies, but it's just not been shown yet, except for probably drug allergies.
Mhm. Of the mysteries of the immune system. Always learning more about that. Okay, so the next one, how do you identify too much sun exposure before it's too late? I go from fine to overheated and sick very fast.
Yes, and I hope I answered your question earlier today. Um, Even ultraviolet light from fluorescent light bulbs and incandescent light bulbs will cause the damage to those cells underneath the skin, and it's all a dose response. But even though you might not feel sick or feel bad or get a rash, only 30% of lupus patients actually get the sun sensitive rash, where they actually, but it goes, these immune complexes go through all the entire body. But you can actually get inflammation in your organs with even just a little bit at a time over long lengths of time. So you really have to be religious. I get scared to heck whenever any of my patient goes on a Caribbean cruise, for example, because they're going to get double the dose of UV light. It bounces off the water in addition to coming from the sun.
Mm,
So unfortunately, you just got to be very, very careful. And I hate telling people who love to hike and things, but you need to learn to do things in the early morning, and the early evening and later is much better.
yes, absolutely. That's some great
And don't
advice.
forget wide brimmed hat when you go outside. Every lupus patient should be putting one on from the door to the car.
Mm, great advice. Susan is here and she said, have you ever heard of lupus causing symptoms such as facial numbness, including the tongue and sudden loss of taste and smell, along with extreme phantom foul smells and random triple vision events?
Systemic lupus, when I hear those things, I usually think of the cranial nerves. Lupus can attack any of the nerves of the body, the brain, the spine, and what we call the peripheral nerves and the autonomic nerves. And the cranial nerves are the ones that give us sensation and strength in the face, the eyes, the tongue, and those areas, the inner ears, which is important for balance and not having ringing in the ears. So whenever I hear those kind of symptoms, I always worry about and want to make sure that my patient is not having a cranial nerve neuropathy. And so what I usually do is I usually get an MRI of the brain with contrast, with gadolinium, to see if that's a possibility. Some people need to also have a lumbar puncture or a spinal tap to help figure it out. And sometimes it's not due to any of those things. And I always get a good neurologist involved to help me figure it out.
Oh, that's a great tip. Yes. Let's see. What if vaccines? Here's a vaccine question. And by the way, August is National Immunization Awareness Month. So we like to talk about that this month. Vaccines are a major trigger for lupus. What do you do if that
Great.
happens?
Yeah, great question. And I hate to disappoint you, but vaccines are not a major trigger for lupus. During COVID-19, I probably had just a couple of patients who may have had a flare of their lupus. And I have around 200 systemic lupus patients, and the vast majority got vaccinated. On the internet, you're going to hear about a lot of flares because it's very biased what you see on the internet. You're not going to see the posts from the people who did just perfectly fine. You're just going to see the posts from people who had those reactions, right? So they've actually done large studies with the flu vaccine, the pneumonia vaccine, and when you look at a very large population of lupus patients, there are no increase in the number of lupus flares compared to what we would generally see in lupus patients, or where they compare them to patients who did not get vaccinated. Well, I am 100% a believer that there are a small number of lupus patients who will have a flare. So if you flared after vaccine, I'm definitely not discounting that because
Mm,
it can happen. In my
mhm,
experience, it seems like it's just to one type of vaccine, though. I've had a patient get a yellow fever vaccine and have a bad flare, yet all the other vaccines did perfectly fine.
mm.
Same thing with flu shot and pneumonia shot. So please don't be afraid of flares, because the vast majority of our patients don't get them. If you do get flares, if they're mild, I would still get the vaccine and just ask your doctor how to treat that flare or prevent it, because I definitely have ways that I can do that for my patients. If it's a severe flare, of course, then you want to avoid it and just get other vaccines instead.
Good information. Is it true? Sorry, now I'm adding in one of my own questions. Is it true with the COVID vaccine that if you do have a robust side effect response to it, that that's actually a good thing? That it's
Yes.
showing, yes. So
And,
you
and
may think it's bad, but it's actually
yes,
good.
and a lot of people mistaken those for lupus flares, by the way,
Mm-hmm,
Kelly.
mm-hmm,
So if you feel like you're flaring, you need to really see your doctor, because just think about it. A lupus flare can be horrible pain, muscle pain,
mm-hmm,
joint pain, fevers, feeling just fatigued and not feeling very well. That's exactly what can happen in a lupus flare. And that's exactly what can happen after the COVID vaccine and anyone. And the more robust it is, the vaccine seems to work better. And that is one of the causes of these undocumented lupus flares that you hear about. But most of the time, they're not really lupus flares; they're COVID reactions, COVID
mm-hmm.
vaccine reactions.
COVID vaccine reactions. Okay, so next question. We're going to have some time for a few more questions, and then we're going to spin the wheel here. Does HCQ, hydroxychloroquine, cause lightheadedness, fatigue, and possibly irregular heartbeat?
Yes, it can cause all of those, Kelly. And with the irregular heartbeat, by the way, tied in with that oftentimes is becoming more anxious and having difficulty sleeping. The way to figure it out, by the way, and always ask your doctor this first, but is to stop the hydroxychloroquine for a week and see what happens. If it goes away, if all those things go away magically, and then restart it and see what happens, then it all once comes back, you know that that's what's happening. And what I do to deal with that is I ask my patients to start off with a tiny dose. Like there's actually 100 milligram tablets available these days. You can get them pretty cheap using goodrx.com because insurance won't cover them. Cut them in quarters. Start off with 1/4 of a 100 a day. That's 25 milligrams. Every few days, go up on the dose, and then just figure out the maximum dose you can take where you don't get the side effects. Also, go to lupusencyclopedia.com and just type in top tips for taking hydroxychloroquine, and I include those kind of things in it. But I can do those, but those are mild side effects that you can get rid of by just figuring out the maximum dose that you can safely take.
Oh, that's interesting. I didn't know about the 100 milligram tablets. That's fantastic. Okay, next question here. Is there a link between Rh negative and lupus cases? Excuse me.
Oh, say that again.
Is there a link between being Rh negative and lupus cases?
Not that I know about, but there's so much in lupus that I'm always surprised about. I'm not going to say no because there's no way I can know all of the medical literature. So I'll have to just say I've never heard of that, but I'm not going to say it doesn't. So I'd have to look that up.
Next.
And by the way, a way to answer this yourself is go to just do a Google search for Google Scholar. That's where we keep all the world's medical literature. Google Scholar, click on it, and then just type in the top RH and then lupus, and then search, and then you can see yourself if there's medical literature showing if that's an association or not. That's a nice trick to learn for everybody. Google Scholar, and you can look for anything in the medical literature that way.
Oh, fantastic. I didn't know that. I just put that in the comments for people to try out on their own. Yeah. Okay, let's see here. Have you noticed any retinal issues, bright lights, and peripheral vision with no hydroxychloroquine? I had terrible side effects, so only took a few days 2 years ago.
Oh, say that again, because you said side effects, but then you said not from hydroxychloroquine.
Looks like Beth stopped it. Yeah. I think the question is, have you noticed any retinal issues with no hydroxychloroquine?
And the answer is absolutely yes. Lupus retinopathy is an absolute thing. It can be due to either damage to the blood vessels of the retina. It can be due to damage to different layers of the retina, like the choroid. We call it choroiditis, for example. People can get vasculitis of the retina. They can get retinitis, which is inflammation of the retina. So there's actually a lot of things that lupus can do to the eye. So anyone who gets any type of vision problem, I ask them to see their eye doctor immediately because there's so many different things that can happen. Most of the time they're afraid it's the hydroxychloroquine. 99.9% of the time it's not from the hydroxychloroquine. Most of the time, by the way, it's from dry eye from Sjogren's disease. Dry eyes and dry mouth because it loves to cause decreased tear film and blurred vision and discomfort in the eye, for example. But yeah, you want to get your foot in the door with a good ophthalmologist and figure out how you can get in right away if you ever get any vision problem, because they can tell exactly where the problem is, what the diagnosis is, and then come up with a treatment plan.
Good word there. Yes. Question about heart risk factors. Is there a way to talk about heart risk factors with autoimmune diseases?
Yeah, absolutely. And fortunately, this is being taught more and more to our primary care doctors, and so hopefully they're listening to this. And all systemic autoimmune diseases and rheumatic diseases, even gout, for example, not only do they cause inflammation in the joints, the kidneys, but also in the blood vessels, and that increases heart attacks and strokes. So even someone who's young, 15 years old, and has lupus is at high risk of cardiovascular events like heart attacks and strokes. So every lupus patient wants to do everything everybody else does: perfect blood pressure, perfect cholesterol. Know your numbers and ask your doctor where you should keep those numbers. Exercising regularly, eating a heart healthy diet, keeping your lupus under control, because that's the main culprit. So never forgetting your medicines, for example, is important. So, and I do go into all of that. In fact, chapter 21 of my book goes into great detail about all the different reasons why, but also how people can stop that from happening or decrease the risk.
Mm-hmm. Very good. Well, speaking of heart healthy diet, what are your top 3 foods? I love this question. You'd include in a diet for lupus patients.
That's wonderful. Okay, so top 3 foods. We have to have an anti-inflammatory food, so it has to be an omega-3 fatty acid. My choice is walnuts. Number one, you know how you can eat like almonds and pecans, you can just eat them and eat them and eat them and can't stop. Walnuts, they're not as tasty, so you don't get binge on them. Just keep a big bag of fresh walnuts that are not roasted or salted. Then grab 6 of them every day and eat. That's one way. Fresh cold water fishes like sardines, anchovies, salmon, have several servings of that every week. So I put those into one. Number 2, you want that probiotic, so help the microbiome. And so I would say a positive culture yogurt every day, or kimchi or kombucha. You can easily look up lists of probiotic foods on the internet. And then 3, you need that food for those probiotics. So you want a prebiotic. And so my favorite is cold oatmeal, but also plantain chips. I eat plantain chips as part of it. It's a nice little snack to have. But if you just have some yogurt with some cold oatmeal in it and eat that every day, and blueberries, that's a great way to have a good anti-inflammatory diet addition.
So get your yogurt with your overnight oats and sprinkle your walnuts on them, and you have yourself a Dr. T approved perfect 3 food list.
Absolutely. And some blueberries.
Well, and some blueberries.
Probably
That's
not,
4, but that's okay.
but don't put any anchovies or sardines in it if you do that.
No. Yeah, no. Oh my goodness. Let's see. We are coming to the last. Oh, and now the person is asking. This is a great follow-up question. 3 foods to avoid. Oh, I love this. Love this.
Yeah, and you're right. There's the North American diet. What do they call it? Someone actually called it the SAD diet. The standard American diet. You can actually call it the SAD diet, SAD. They've actually shown studies where people who eat an American diet actually, you've heard of epigenetics, and that's one way that lupus occurs. For example, smoking, it changes the molecular changes around DNA. We call that epigenetics. It's been shown that the bad foods in the North American SAD diet actually cause epigenetic changes around DNA and can increase the risk of autoimmune diseases and so forth. So you want to stay away from the bad foods, and those would be things like fried foods, processed foods, simple sugars, red meats. So those kind of foods are all in the bad list. You can eat just little bits of those things, but you want to have a lot more of the healthy stuff. You want to try to have as much natural as you can, vegetables and fruits. Shop the perimeter of the grocery store. Stay away from those central aisles that have cans and the fast food. Stay away from anything that has fructose corn syrup in the top ingredients.
And would you say, is it better to drink Diet Coke or a regular Coke every once in a while?
No Coke, but I have to say, you just saw me drinking some hint water, but I have to, I'm human too.
Thank you for being honest. I do occasionally drink Coke Zero, but yes.
We're all human.
Oh my goodness. Well, look at this.
Also, I recommend intermittent fasting, by the way. I do that religiously. I kept 40 pounds off in the last 5 years, much easier than any diet. There's a lot of great research showing intermittent fasting is healthy for us and probably is helpful for people with autoimmune diseases.
Yeah. Yes, that is a great tip as well. And I know you've talked about that before here. And also, I know everyone went out and bought that yogurt that you talked about.
Siggi's, SIGGIS. Get the short one that's high in fat and protein, not the tall one. The tall ones, they have actually more sugars in them and less fat. But the fatty protein one, it will make you full faster, and so it's actually better for a diet as far as making you eat less, but healthy for you.
And good for the microbiome. Okay, so I don't know if you can see this, but we've got so many people on that wheel there. This is by far our biggest spin the wheel we've ever done.
Great.
Thank you to everyone who shared this. There's over 20 people there. And I went back and checked, and I think I got everyone. Let me just make sure no one else is writing here.
And whoever wins, by the way, email me at Lupus Encyclopedia at gmail.com. Lupus Encyclopedia at gmail.com. I also put it in the comments earlier during this broadcast as well.
Okay, we just had one last minute person share it, so I'll make sure. Okay, all right, everyone. Time to spin the wheel. And just as a reminder that you would be receiving, if you won the spin the wheel, a brand new copy of the latest edition of the Lupus Encyclopedia with that beautiful purple cover that, by the way, us patients got a little say in. He did a little survey on his page, which was super fun. That was my pick, so I'm excited to get to see that. And you will get that. I will put it in the comments who won as well. And also remind you to send your address to Dr. T, and he will personally sign it for you and ship it to you. Thank you, Dr. T, so much for this. This has been incredibly exciting and informative.
So can you tell us who won?
I'm going to spin it right here, right now. It's happening. All right, you ready, guys?
Good luck, everyone.
Who won? Jennifer T. Jennifer T, you just won a copy of the second edition of the Lupus Encyclopedia.
Great. Congratulations, Jennifer Tabor. I'm so happy for you.
Jennifer, that is so exciting. Wow.
So send me your shipping address and I'll get it out to you as soon as I can.
Wonderful. And for all of us, people who didn't win, guess what? It's available September 5th, right? So now
yes.
September 5th? Yes. So we can pre-order it now, and it will be out in just a few weeks. So really excited about that, guys. Thank you again, Dr. T. I don't want to take up any more of your time because I know it's 3 hours later where you are on the East Coast. Your knowledge, your accessibility, the way you care for us lupus patients is so appreciative. We love you, and we are so grateful for your commitment to this work and for constantly wanting to learn more about a disease that we all live with. Thank you. Thank you. Thank you.
And thank you for all your wonderful work, Kelly. And everybody, remember, knowledge is power. You can learn to conquer lupus and not let lupus conquer you.
Oh, what a great way to end it. I'm not going to speak over that. Have a great rest of your day, guys. Take care. See you soon. Bye-bye.